Okay, so I just wanted to show exactly how we carry our diabetes stuff around so that this is helpful when you're first diagnosed and wondering what to carry. So I've got this cooler bag. I'll start with this. So this is a lunch bag. Now it happens to be insulated. It just has a little foam lining in here. So if we are going someplace hot, I can throw a ice pack in there. Not that the insulin needs to stay refrigerated, but if it's going to be 100 degrees outside or 100 degrees in my car, I want this to be a little bit insulated, protected from that. So it's protecting it from getting too hot rather than refrigerating it. Same goes for these other supplies that are like living in here all the time. So this is the Gvoke pen. This is an emergency glucagon pen. The Baqsimi nasal spray is an emergency glucagon powder that is administered nasally. So those are two different options. I carry both pretty much everywhere we go so that we have the choice to use. Some people, if they've been trained to use an EpiPen, are going to be very comfortable with a Gvoke HypoPen. And if they're not, they may be much more comfortable with Baqsimi. So we pretty much keep both around, and then we have the choice. We use glucose tablets to treat lows very frequently, so that's a common thing that you'll always find in our bag. And then this is the glucometer test kit that we use. And I just wanted to show, I'm not even sure how this is designed, but we keep alcohol in there. I keep these little cotton swabs to wipe. They're just like the cosmetic things you'd use for makeup remover or nail polish remover. I keep those in there so that you can wipe the first drop of blood that comes. And this is the tube that the test strips come in for this particular type of monitor. But there's no room in this kit for the lancets. So I actually use an empty test strip container, sorry, that's the word, and I put our new lancets in here. So I always keep, a dozen or so in there, and then it fits right in that little holder. So I always have both accessible. It's a little bit clunky. They have to kind of sit here just right in order for this to close, but I assure you it does. I also carry this little first aid kit. So this came from Target. It comes free with a certain purchase of Band-Aids and first aid supplies. So this also lives in the kit just to keep things a little bit more organized. This is something I always like to keep around. This is a skin grip cover for the Dexcom. So just to give you a little visual, it's this little skin grip patch. I get them on Amazon, I think, so that you can have some reassurance. I tend to not put an over grip on until it's starting to fall off. So I'll wait to day 4, 5, 6, 7, maybe never. But if it starts to peel up around the edges, then I'll put one on, which is why I keep one where we are on the go in our travel bag. So, okay, in this first aid kit, this has changed over time since we are on a pump, not multiple daily injections, but I'll start with injections since that's what you're on now. We've got, I use an InPen, so hit me up and ask questions about that. I love InPen, it's amazing. And it has so many different benefits to it. I keep that. You can use all different types of insulin in there. We also keep Lantus. Even though we're on a pump, I carry the stuff for emergency in case the pump should ever fail. This is actually cartridge for the InPen. I also carry syringes so that if for some reason the pen's not working, I didn't really do that until we started the pump, but I have both methods now, and then pen needles. So of course, when you are on multiple daily injections, you're gonna go through a lot of those. These are just ones I carry for backup. I found this little container it's made for Q-tips. And I use it as a sharps container. Now we don't really have much sharps in here, so right now it's kind of medical trash. But when we were doing injections, I'd end up with all of these used pen needles and no place to put them. So I carry this little sharps container. There's a lot of different things you could find that would work for you in that situation. This is a diabetes travel letter. So you can ask your doctor for that, and it's basically a letter that says this person is allowed to carry supplies at all times. And I haven't really had to use it except maybe once at an airport. Concert venues, sometimes you're not allowed to bring bags. I have that with me just in the case of that. I want to show my personal information here, but I also keep this little index card that has emergency instructions. So I've got emergency phone numbers. I also have a super concise this is normal blood sugar. A low blood sugar is under this number, and this is how we treat it. A high blood sugar is over this number. That means she needs insulin. So it's a way to communicate. So when we're doing sleepovers or play dates at friends' houses, I always point that out and give them a quick refresher. And I don't expect them to remember anything because I've written what I need them to know on there. Okay, and then again, like I said, we're on a pump, so we keep with Omnipod 5, so you see it. I always keep a spare pump. It gets changed out every 3 days, but they often die early for various reasons, so I keep that. I also have the supplies that I need to take care of that. So I've got some alcohol to put a new one on. We use prescription lidocaine cream to make pod changes that much easier. I just noticed I'm out of Tegaderm patches that we use. This cream has to sit on for about an hour. So I put a little dab of cream, then we cover it with a clear Tegaderm patch and let it sit for an hour while we go about regular life. And then we put our pod on. And then I just carry the insulin in here as well. Again, doesn't have to be refrigerated once it's already open. And then Skin Grip makes a little over grip for the pod as well. So any pumps will have an over grip option available. So, or an over patch option. So this is what we use. I call this the seat belt across the middle. I didn't make that up, but I think it's brilliant. And it does help to provide some extra security to keep the pod in place. However, just FYI, it actually puts a little bit too much pressure because you can see there's no space for the thickness of the pod. So I actually keep scissors in here so that I can cut that down the middle, and I can show you a different video how that actually works when you get to that point, if you get to that point, and that would be helpful. So wherever we go, I've got this lunch bag with this first aid kit, her glucometer, tabs, an emergency glucagon, and that is basically all I carry. This kit now usually just stays in the car. Again, when we were on multiple daily injections, I would tend to bring it everywhere because I just needed to use injections more often, and then I would need it. With the pump, I just want to make sure it's reachable. But then I'll have usually this, because it gets thrown around in my purse a little bit easier. We always have everywhere some kind of glucagon. I've got one in every car. I've got one in the soccer bag, in the dance bag, and extras just in the case of emergency. So when I stopped carrying this bag everywhere, I had to make sure that I had more of these things available. And then always some kind of low treatments. This is a giant bottle that I keep in here, but they come in small 10-tab tubes, and there's certainly lots of other things you can use for low treatments. But that's what we do. I hope you found that helpful, not too overwhelming, and refer back to it, ask questions anytime.